Here with Christie Kidd, fearless female, take one. Hi, I'm Janet Gunn here with Focus TV, and I'm sitting next to the beautiful Christie Kidd. So today we're going to be chatting about her top laser picks, adult acne, and a lot of solutions that will be perfect for your skin type. Stay tuned. So it seems that every time I sit down to read a newspaper or a magazine, I find another article on the newest laser, the newest treatment, the newest filler, and it's overwhelming. So how do you know which treatment is best for you?
That's a good question because it's overwhelming. There's a lot of information out there, and it could be very confusing for the patient. And I think that's where the trust in your provider comes in. You have to have a good relationship with who's treating you. And that's my job. You know, I will sit there and explain every laser to you, every filler, and decide really what's best for your skin. You know, what's good for one might not be good for the other.
Right.
But as far as like fillers, I mean, definitely I would say all injectors. We have our favorites for sure. There's some I don't do at all. And, you know, I have my favorites.
Can you say what your favorites are?
Yeah, my favorite is Juvederm Ultra and Juvederm Ultra Plus and Voluma, which is also a product of Juvederm. So I like that product because it's made with hyaluronic acid, which is something that's found in our body naturally anyway. So it's just synthetically derived, and it's put in a syringe and injected into the face. It's very soft.
And then what's the difference between Juvederm and Juvederm Ultra?
So Juvederm, there's Juvederm Ultra and Juvederm Ultra Plus.
Oh, okay.
So the Ultra Plus is just a little bit more of a robust filler. You know, so if somebody has a deeper line, you know, if somebody has a little feathery line and they don't want a lot in their lips, I'll use Juvederm Ultra. But if they have a deeper laugh line, deeper marionette line, I'm going to do the Ultra Plus.
And then Botox is still top on people's list, right?
Botox is, Botox is still definitely probably the king in that area. There is Dysport, and Dysport is great, but I just think Botox has been around longer. So I think as far as injectors and patients, they just have a more comfortable feel with it. They just feel safer using it. But Dysport is great.
And then also, do you do a lot of Botox in the neck area?
Oh, yeah.
Yeah.
Platysmal bands in the neck have to be probably one of my favorite, actually, because when you get maybe about 40 and up is when you really start to notice like we're losing fat.
Right.
And so the platysmal bands are starting to show. Things are starting to show, especially on somebody who's thin or very athletic and very fit. They pop out. When you're working out, they pop out. And they really pull the face down.
Yes.
So when we inject the neck bands, it looks amazing. It's great for the neck. It's great for the jaw.
I have to say, I've used it on my neck several times because I am that thin, athletic, and fit.
Right.
And so as I have been aging, I've noticed that right there, that area, and using the Botox there, it really makes a difference. I like the way it looks.
Yes, it's a game changer for me.
Yeah.
I think if I were 50 plus and my platysmal bands were bad and so was my forehead and I could only pick one area, I'd cut bangs and I'd put Botox in my neck. We live in LA, it's hot.
Yeah.
You cannot wear a scarf every day.
No, can't get away with that.
No.
As much as I'd like to, it doesn't work.
Yeah, it's a great fix. And you know there's a new little fix out there too. Kybella.
I just was reading something about that.
Kybella is great. It's for like the unwanted neck fullness, which we all will just call a double chin.
Okay.
But a double chin can come in many sizes. It could be tiny. I have one, it's tiny, but I want it gone.
Yeah.
Or it could be quite a bit bigger. Kybella is going to dissolve the fat and then make the skin tight again. So between the combination of a little Kybella and a little Botox, the contour is amazing.
So you're getting positive results from that.
Amazing.
Oh, that's
and
good
the
to
Kybella
know.
is forever.
Kybella.
Yeah.
All right,
and that's forever improvement.
Oh.
1 to 2 treatments, forever.
Oh, that's new and cutting edge.
Yeah, it's brand
like
new.
that.
It's brand new.
Well, I want to ask about the alt therapy too.
Oh, yeah.
Okay, so I had it done a couple of years ago, and I saw great results. I really liked it. Yes, it was painful, a little scary, painful, but I saw really good results. And then I was talking to another friend of mine's friend who's a doctor, And he said, I would never do oil therapy on you because you're thin, you don't have a lot of extra collagen in your neck. So if you do that, you're burning away what you have. What's your advice on that?
Well, in my opinion, that's not maybe exactly a good description.
Okay.
Yes, the thinner we are, the thinner skin, like Caucasians have thinner skin, right? So we just have maybe less collagen. And if you think of collagen, it's layered like lasagna. So I always tell my patients, think of it as like a lasagna, and you have all these layers, okay? And your collagen is getting loose and lazy as we get a little bit older. And we want to re-stimulate it and make it grow again and become tight. There's different transducers on the Ulthera machine. So they hit a different depth, 4.5 millimeter and up, 3.5 millimeter and up, and so on. So on someone like you, I wouldn't use the blue transducer.
Okay.
I would use the green because it's a different level. That's the 3.5 millimeter. Yes, if I did the deep one on you, the 4.5 millimeter, I'm missing the collagen. I'm like going past it. And now I'm not doing anything. I might even actually be getting into your fat layers.
Okay.
So you're missing the boat, totally. So like I would always do Ulthera, and I do Ulthera, and it is amazing.
And let's talk about
you.
There's no downtime.
No.
There was no downtime.
None. You can get an occasional bruise. I do see people get an occasional bruise in the jaw area.
Yeah.
It can happen, but it's not going to put you out of commission.
And then with lasers, because there's so many. I have never had a laser done because I've heard sometimes you can have discoloration, that I don't know what's right for my skin. So that's another thing that you would have to come to you, and you would recommend the laser that is best for the skin type and color and downtime and whatever your patient is looking for, right?
Yeah, I think that's when you need to have a really good conversation with your provider. And no provider that I know of, myself included, we don't all own every machine because there's literally hundreds of them. And they're expensive, and half of them don't work.
Yeah.
So, we all own our favorite devices.
Yeah.
I tend to be on the more conservative side. Like, I want you to look youthful and beautiful, and I'm not going to do anything to even risk damaging your skin. So all the ones that I do are very powerful, but they're not going to hurt you.
Good
I would
know.
rather do a lot of medium, I'll call it medium lasers. I would do it all the time as opposed to every 5 years knocking it out with something really heavy.
Right.
I would just rather keep it pretty the whole time.
The maintenance part of it. I would too, rather than just have one thing and hope nothing, turns out drastic.
Yeah, and then those ladies often think, well, I did this, so I'm done. Well, you're not. You have to maintain.
Like anything, you maintain your physical fitness, your body, your brain. Everything is a maintenance program.
Right. We don't eat once a year.
Don't eat once a year.
We eat a little food every day.
And then I want to ask you about cystic acne, because when I was in I'd say my mid-30s, I had horrible cysts that came up, and it was painful. And I never had pimples or acne when I was a teenager. I never had it. So when I was 34 years old, all of a sudden, it was pretty much all in this area. I had these really hard cystic acne. I would go into my dermatologist at the time, and thank goodness he would inject the, is it Kenalog?
Cortisone. Well, we used cortisone he probably or she used Kenalog.
Okay.
Yeah.
Okay. And it would take down the inflammation.
Yes.
But it would take a week to recover.
Yeah, cystic acne is tough. You can get it in your teens. You had adult onset acne.
Yeah.
That hits between like 24 and 34. And that's rough because you never had a pimple in your life. Then all of a sudden, boom, 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 cyst city. We do a lot of laser. The one that's great for acne is called Laser Genesis.
Okay.
It's really good. Brings down the inflammation. It helps with the redness. At the same time, it's working on the old scars too. So I always say, think of, people are upset about the pock marks that these cysts leave. I said, well, it's just like when you go for a walk at the beach and you've left your big footprint in the sand. It doesn't go away with one wave. Like several waves have to come up and wash that footprint away. It's the same thing when you have a pock mark. Like we have to do several things. It's not a one-hit wonder.
Yeah.
We need to do a few rounds of laser, a little bit of acid, everything to stimulate that collagen to grow again where it got smushed out by that cyst.
I also know you're a mom. You have an adorable little boy.
Thank you.
Yes, you're married. So
Yeah.
how do you do that with your work and your balance and having your patients? And it's a busy life. So
It's a busy life.
Yeah.
It's fun, very fulfilled. Of course, my biggest blessing in life is being a mom and a wife.
Yeah.
That's number one. I feel like it took me time to navigate and find my way because I got married a little bit later in life. In a way, fortunately, that worked out because I had my practice was going.
Right.
I didn't like graduate and then get married. Like I'd
Yeah.
been working a good amount of years.
Yeah.
So I had the work thing down and the practice was going. And then I met my husband and we had our baby. So what I have to schedule out time for myself. If I literally put it on the calendar, I have to write it down.
Yes.
And then it will happen. Because if I don't, I absolutely get forgotten.
Oh, I'm sure. And I would think
Like
too
we do that as moms.
you have patients who are demanding of your time who, maybe need to come in and
Yeah.
unless you figure out how to carve out that time for yourself.
Yes, like
It's
I will
important.
think in my head, like, oh, after my last patient, I have enough time to go to yoga and then go get Jason from preschool. And then sure enough, my receptionist will be like, so-and-so is desperate to come in. They have a mole that's bleeding. They're terrified. They don't want to go all weekend. And then of course, I'm like, of course. I'm going to stay and see them. And then again, now I'm not going to go to yoga. So I will always stay for them and do that. But then I will also never miss anything for my son. He is my priority. So if there's a school function or something, I'm not missing it.
Good for
It's not
you.
going to happen.
Oh, that's nice.
But I'll miss my stuff. I
Yeah.
might not haven't had a manicure in 2 weeks, so I haven't gone to yoga yet. But I'm finding my way to that's what I have found works for me. I have to actually block it out of my schedule.
Yes.
And be like, nope, during this time, I am going to the doctor.
Yeah.
Or I am going to get my mammogram.
Right, because you have to take care of yourself too.
Yes.
Well, before we wrap up, I always like to ask my guests 4 questions. So first of all, tell me, what are you grateful for today?
My health and my happiness.
And then what is something that we wouldn't know about you from your resume?
That I love animals so much.
Aw.
That I work for animal rescues and I love animals.
Oh, that's great.
I love those fur babies.
Oh,
Yeah,
thank you for
it's my
people
other
like
passion.
you. That's lovely.
Yeah.
And then what's your morning routine?
If I laugh because my husband's like, you wake up like Cinderella. I do. I wake up, I'm happy. I run downstairs, get a cup of coffee, get in bed with my little boy, and we snuggle for about 15 minutes because my husband is not a morning person.
Yeah.
And then we slowly wake him up. And then we're all up together having coffee and milk and, oatmeal and whatever.
Can
and
we
having
start
a fun
the
morning.
day?
Yeah.
Good.
And feeding my 4 animals.
Of course.
Yeah. Don't forget them.
And if you could hold anybody's hand today, whose would it be?
Oh, my mom.
Your mom.
She passed away 7 years ago. I would hold her hand.
Well, I'm sure she's unbelievably proud of you.
Yeah, she's the best.
Absolutely. You're fearless. You're beautiful. You're wonderful. Thank you so much for your
Thank
time.
you.
I really appreciate all this great information that
Thank
you
you,
shared with
Janet.
us.
Thank you for
We
doing
need
this.
info.
You're amazing.
Of course. Thank you.
Thank you.